Track to Success. I am Lauren Belina Chang. I'm the Vice President of Strategic Growth at Clinical Research Fastrack. What does that mean? My goal, my focus is helping all of our students to grow in a very strategic way in a very confusing field. Where do you go? How do you start? What do you do once you get in? That's really my area of expertise. I am so excited to welcome Fastrack alumna Sara Iaconi into our Fastrack to Success Zoom room. Hi, Sara.
Hi.
How are you today?
Great. Glad to
Awesome.
be here.
It's so good to see you. I was just catching up with Sara, and we have met almost 5 years ago, which is kind of wild. I met Sara back in our actual live classroom in Dallas, Texas in December of 2018. Kind of hard to believe, but Sara, I know a lot has been going on since we first met, your journey and through clinical research. So I'd love to turn it over to you and just have you introduce yourself.
Yeah, I'm Sara Iaconi. I'm a clinical research associate now at Castle Biosciences Incorporated. I'm a wife, a mom of one, almost 1 year old, and I live right outside of Richmond, Virginia. I love our area, my job. I mean, everything right now is just going well in life, and yeah, I can't wait to share more.
That's awesome. So, Sara, I know a lot of times people come into our classroom and they're like, CRA, that sounds like an amazing job. That's what I want to be when I grow up. It sounds like really amazing. But you didn't start as a CRA. I know you're a CRA now. Tell us a little bit about your first role, kind of what you did, how long you were there, and then your jump into being a CRA.
Yeah. So, actually, prior to taking the clinical research fast track, I had applied to hundreds of clinical research coordinator jobs and got zero callbacks, zero emails. Nobody was interested. Although I had a health science background and degree, I guess because I had, no knowledge of the research field at all. Nobody was interested in me. And then I took
I
the
mean, and you were a medical assistant too, right?
Yes, I was a certified nurse assistant and a medical assistant. Yeah, and with all that, experience, they still didn't want me for some reason. So then I took the clinical research fast track class, kind of geared in my resume like you all teach, and I got like 3 calls and 2 interviews. And I ended up taking one of the jobs as a clinical research coordinator at a university hospital here. And I learned a lot about even more in depth, not only like site stuff, but like the regulatory aspects of things, and kind of got to a point where I was like, I've kind of learned everything I can learn at this point, and I either need a promotion or I need to look at somewhere else. And unfortunately, at my university, it was really hard to progress, and there wasn't a clear clinical like career ladder in the research realm. So then I started to look outside, and I heard about Castle Biosciences through a former colleague, and she had just started there as a CRA, and they were looking for more East Coast kind of remote people. So I applied, and after 3 interviews, got because they have a lot.
But now, so you're behind the scenes. So now what is that like? I mean, you don't have that patient interaction anymore. So what's your day to day?
Right. Yeah, so my day to day, I feel like, so I travel usually about twice a month, which is not bad at all. So I try to schedule my site visits, whether it be remote or in person. Since COVID happened, there's a lot more remote, which is great. Because I'm, a mom, and I don't like to leave my baby all the time. So usually what I'm doing is either wrapping up a monitoring report from the previous week, or I am prepping for the next one. So like, let's say this was a monitoring week, which actually it was. I monitored Monday, Tuesday. And then, Wednesday, Thursday, I worked on my report of how things went. I sent the site, a follow-up letter of, things you need to fix. And then I kind of started looking at my queries that I'd placed and any prior monitoring visit queries to close those out. because some sites take longer than others to look at them, which is fine. And then now next week is not a travel week, so I will prep for my next monitoring trip, which is the following week. And I did a lot of scheduling this week too. I was looking into April to see, who needs to be seen, and reaching out to my fellow CRAs too to see who needs help, because a lot of my sites are in a good spot right now, where I don't need to see them all the time. So yeah, so I
Love
do
that
have
for
a
you.
little bit of flexibility. I do a little bit of like personal development as well. So I try to listen to like audiobooks like once a week as well for a couple hours during my work day. Because our company really pushes for that to develop and help learn more every day, and not just being complacent in your current position.
I love that. I love
Mhm.
that. And from your stories, I'm gathering that you're becoming like this master relationship builder. It sounds like when you were site level, it was all about those relationships. Now here, seems like you have very good rapport with your sites,
Oh
and
yeah.
they're all in a good spot too. I mean,
Yeah.
that's your effort too. So that's pretty awesome. Congratulations on that.
Yeah, I'm like on a text basis with a couple of my sites now, and I'm like, that's when you've made it with a site, is like when they shoot you a text and like, hey Sarah, I've got a quick question, and I'm like, got you, girl,
Yeah.
what's up?
You're like, oh, now we're on emoji basis. We're in. We got it.
Yeah,
I love
yeah,
it.
exactly.
That is awesome.
Yeah.
All right. I want to do something that I think is fun that we do on Fast Track to Success. I'm going to show you a flashback to class. Are you ready for it?
Okay.
All right. Do you remember this photo?
Yeah.
I remember it was December. They had the Christmas tree set up. We were in the
Yeah.
lobby of the embassy suites. Now, Sarah, you're in the back. Your hair was longer then.
Mhm.
You look pretty happy there.
Yeah.
I got to ask you though. I got to ask you about this story.
Hmm.
I remember. I don't know if you remember your
Okay.
first day of class. Okay, this was back when we were in person. We're virtual now. We're
Yeah.
at the Zoom room. Still able to cultivate a lot of those really good connections in the classroom though. In the Zoom room. But back then, you went to Dallas, Texas. You traveled all the way there. And day one, you walked in, and I could tell you're a little nervous. And I think it was around lunchtime, you told us that you had your uncle who dropped you off wait in the car to bring you home in case it didn't work out. Is that true?
It is true. Now that you remind me, it is. But wow, okay, that's so strange. But yeah.
I remember that because I think in the afternoon you started to relax a little bit and you're like, okay, this is all real. These people are real. We're getting good content.
Yeah. Yeah, yeah. I remember, so my dad was the one that was a little bit suspicious.
Mhm.
He was like, "Okay, I'll pay for this course, whatever." He was helping me out financially at the time a little bit. But he was definitely suspicious about it. So he was like, "Maybe you should just ask Uncle David if he can hang around a little bit just in case." And I was a young single girl, so like I don't know, you hear horror stories. So I was definitely like, share my location and everything just in case.
Oh my gosh. Well, tell Uncle David we said hi. And thanks for waiting in the car that day.
Right.
That is awesome. I'm glad you stuck it out.
Yeah.
All right, we're now going to go into our lightning round, okay? Just
Okay.
a few quick questions. First thing that comes to mind, that's what I want you to throw out and answer. So, what is your favorite moment on the job so far? Could be any of your jobs that you've had. What's your favorite moment? Real softball to lead in with.
I know, right? On any of my jobs. I think so I had a patient, when I was a coordinator, I didn't do many drug studies, but I did do one, and just like having a follow-up with him, and I had really good relationships with my patients too. Like they were like definitely wanting my number and to text me and stuff like that. But I had one patient who, went through the trial, was like near the end of it, and it was about hepatic encephalopathy. So that's when patients don't really think clearly because of their liver disease. And it had made such a difference for him in his life, and like the day to day, just being able to, communicate with his wife and not have to go to the hospital once a week because his ammonia levels were so high and he wasn't thinking clearly. And like, getting up in the middle of the night and wandering and not knowing what's going on and not even remembering it. And so it just made a huge difference for him. And it just made me feel so good too, being able to, be a part of that and help him get into the study. And really, it made me feel like, wow, we're really making a difference.
Oh, wow. That's a huge one. Of course. Yeah. That's like top of the top. That's amazing.
Yeah.
Last lightning round question. A big one. You ready?
Okay.
What impact do you want to make throughout your career?
Oh, wow. I definitely just want to, make a difference in people's lives. I definitely have my sights set on eventually getting into the mental health field, because I've had, so much personal experience with that, with different, tests and stuff that can help you get to where you need to be. And I want to be able to do the same for others, and, just continue to grow and help and make a difference, and do it the right way, because I'm definitely one of those people that I don't want just the data. I want it to be right, and I want it to be clean, and I want, to make a real difference and not just, have 1,000 patients that did this thing. It's like you want it to actually mean something.
Oh, that's beautiful. I think you had an interest in mental health way back when we first met too. I feel like
Yeah.
I remember having those conversations, but I also remember talking about how research is kind of nice because you don't get pigeonholed into one singular therapeutic area. You could be
Right.
working on liver disease one day and,
Now I'm in
schizophrenia the
derm.
next. And yeah, exactly. You can hop all over
Yeah.
the place. So that's amazing. What kind of roles do you think you want to, evolve into in the future? What do you have your sights on?
Well, ultimate goal, VP of a CRO. Yeah.
Absolutely.
Um, but my next step would probably be like an associate project manager, or project manager, depending on how that works. And then kind of go up from there. And I like to be able to, work on protocols and be at those round tables with the scientists to discuss, how can we make this better for the patients.
Beautiful. You are on your way to being that key opinion leader. I can't wait. Don't forget me when you're at the top.
Of
Uh,
course.
Sarah, one last question for you. What
Yeah.
advice do you have to people new in the field? I know as a CRA, you do a lot of teaching and mentoring to sites, like you're saying, the research naive sites, coordinators who maybe think they know it all, but might need a little pressure. That ever happens. But Sarah, what advice do you have for people just getting started?
Yeah, I think when you get started, my biggest advice would be open. Don't set yourself on like I love mental health. Have I worked in the mental health field yet? No, but my career's just started. I'm only 30, and I'll get there, and I know that. So getting your foot in the door and just getting the experience, no matter, where it's at, I think is so important, because that opens so many doors, in the next stage. Unless like the site or place you're working at is like astronomically horrible and non-compliant, and they're getting kappas every month, then hang it out at least a year so you can get that experience. Even if it's something you're totally not interested in. Like I was not interested in liver disease at all when I got the job, but I was like, let me just try it out. I don't know anything about liver disease. I actually ended up loving it. And I feel like I'm almost like an expert in a lot of things. I was like messaging, by the end of it, I was like messaging the doctor saying, hey, this patient needs XYZ medication because of X. Because like you get really in depth into your field. And now I'm learning a ton about dermatology, and it's really interesting too. So it was never a field that I thought I'd be interested in, but you get into it, and then you kind of learn to love it. So then kind of go from there. Once you have that experience, then start applying to all over, depending on where you want to move up in the career ladder of your choice, whether it be at the site level or through a CRO or something.
Awesome.
Yeah.
That's great advice. I appreciate you sharing that with everyone.
Mhm.
You heard it here first from Sara, future VP of a major CRO. I can't wait until that happens.
Yeah.
That is awesome. Sara, I appreciate you joining us today, sharing with us a little bit about your career
Yeah.
path. You have been fast-tracked to success.
Yeah.
So we're so excited to support you throughout your career. We'll catch up soon.
Sounds good.
Thanks.